Good afternoon. Thank you for joining us. I'm Nick Abouassali. It's been nearly 70 days since the governor declared a state of emergency. We have all been successfully distancing now for about 10 weeks. Thank you to all who have been doing their part and listening to the guidelines of our governor and our county health experts. Because we've done our part, we've been able to slow the spread of the virus and get to this point where the governor has begun lifting restrictions and allowing people to go back to work and slowly return to the tasks and activities we need to do and enjoy doing. As we transition to this phase, our responsibility to each other does not end here. We have an ongoing need for everyone to do their part and continue following the guidelines and help our people and our businesses make it through this crisis as successfully as possible. Our local governments are all working toward this goal. One thing that Marion is doing is we have formed the Community Recovery Task Force. This task force is proactively working to help our community recover in coordination with neighboring cities. The task force is made up of 15 members representing a wide cross-section of the community, including business and economic development, city government, faith communities, medical and mental health fields, human services, and education. We wanted this to be inclusive and a holistic approach to emphasize that no one can do this alone. We all must work together collaboratively to give our community, both people and businesses, the best chances for success. In the 2 weeks since its activation, the task force is hard at work in assessing the needs and addressing them. We're providing comprehensive guidelines and resources to businesses and employers on reopening and keeping people safe. And we've launched a consumer confidence survey to determine the confidence of residents as businesses start to reopen to shape service delivery and identify areas where the task force can assist. Safety of people, employees, and the people who are patronizing our businesses is at the forefront of our efforts, and all Linn County governments and economic development entities in providing reopening and recovery guidelines. As we do all of this, I ask everyone to remember that reopening of business and facilities is not exactly business as usual. We still have community spread, and we'll all need to be mindful of the things we need to do to be able to exist with the virus in our community as we go about our daily lives and keeping ourselves and others safe. We can do that if we conduct ourselves in a smart and common sense way. We all know by now what we need to do to minimize our chances of contracting and spreading the virus. Distance as we interact with people, wear masks when appropriate, wash our hands and sanitize after touching surfaces and things that are touched by others. And finally, I ask all of us to please let kindness and understanding guide our thoughts, our words, and our actions. These are emotional and trying times. There are many varying opinions on how to deal with this unprecedented situation. Everyone is doing their best to navigate this new environment with the information available at any point in time. Not every decision will please everyone, and no one has a monopoly on all the right ideas. Let's be thoughtful, responsible, and above all, kind in how we treat each other. That is what will show the world who we are as a region. Thank you.
Good afternoon. Dr. Tony Myers, Mercy Medical Center, Vice President of Medical Affairs. I'm going to start off just by talking about current state in the hospital. We have right now 4 patients with COVID-19 in the intensive care unit, and 2 of them are on ventilators. People that have heard me talk about numbers in the past will know that that's kind of low. So over the last week to week and a half, we have seen that lower census, overall number in the hospital, compared to, for several weeks there, 4 or 5 weeks, we had a pretty consistent census of 8 to 12 in the intensive care unit, and 4 to 8 on ventilators. So, 2 to 3 times as many at that time. And that was relatively stable too. We would have slight surges, but it would be in those numbers. And so over the last week and a half, it's less. So I am cautiously optimistic. Essentially, it appears that we have, in effect, protected the healthcare system's capacity to care for people. This was hard and it was stressful, and I wish I could say it's over, but it isn't. So what do we need to continue to do? What's working? I'd like to say that the virus is just going to fade away and die off in the summer, and that's just not true. It's going to be here. It's going to make people critically ill, and hopefully it's low numbers like we are seeing. So what have we been doing? We have been doing the hand washing, staying at home when sick, social distancing, and masking when appropriate. And while not everybody is doing this perfectly, because it's hard to do perfectly all the time, there are lots of people that are doing this very well. And those, especially people that are at high risk for getting critically ill and critically sick and having to go to the hospital and be on ventilators. They're doing a really good job at all of those things, and they need to continue to do that. We know that young people can still get this. They're just less likely to end up in the hospital from it. Second thing that needs to continue is that caregivers stay well. And when we were talking about this planning initially 3 months ago, one of the things that was very scary in other countries was that the healthcare system, some hospital staff rates were 30% of them were ill. And there's just no way you can take care of patients when that many staff are ill. And that has not happened here, both in the hospitals, nursing facilities, and really any caregiver. Home caregivers have managed to keep themselves well. How have they done that? They've done it by doing the things that we talked about the community members doing, but they have also dealt with inconvenient and constant screening at the hospitals and the nursing facilities, and the use of uncomfortable personal protective equipment, and they've done all this with patience and grace, and we need to continue to do that. The health department. The health department needs to continue its strong work. There's a whole list of things I could go through, but anything from Heather's strong and persistent messaging to the support and the strong support of the nursing facilities, initially mitigating outbreaks, but now to the point of preventing things from getting out of hand at nursing homes, which is critically important to the hospital as well. And employers are taking steps to protect their employees and customers, and this is very important. All of these things have helped, and all of them need to continue. Moving forward from the hospital perspective, we did all of this extensive rapid planning when we started to move into the COVID crisis. We are doing the same type of extensive planning now as we start to provide care that is necessary, but it's been delayed due to the COVID crisis. As we do that, we need to be very cognizant of the possibility that there could be a surge in the virus. Now, I think it's unlikely that the surge is going to be worse than what our initial surge was and controllable as long as we're all smart about this, and I don't think there's any reason why we wouldn't be. But we also need to realize that we're in a much stronger position from a healthcare system across the county, across the region actually. The relationships that we've developed with Unity Point, that's strong, helpful, and will continue. We also, both hospitals, understand how to rapidly redeploy space, staff, and other resources. If we need to, we can go backwards, and we can do it quickly. We're in a much better position with personal protective equipment. The supply line has stabilized. We can get masks, gloves, gowns, and shields now, and we are, as we move forward, stockpiling when possible in case the supply chain would get disrupted in the future. We're also in a much better position in supply of medications. There was a lot of concern that there would be critical shortages of medications early on. There was lots of excellent planning done at the hospitals, and right now we are not concerned that we're going to run out of medications, especially for critically ill patients on ventilators. That's much more stable. And testing has improved. Now, testing still has a ways to go, but it is faster. There's more options. There's a state hygienic lab, there's commercial labs, there's in-house hospital testing. There is still not enough supplies. The tests are still a little bit slow, but they're getting better, and there appears to be light at the end of the tunnel. So in closing, I want to thank all caregivers in the community for their effort and support during this crisis. And while it's not over, we are stronger, and we now know a path to follow. Thank you.
Good afternoon. My name is Heather Metter, and I am the supervisor for the Clinical Services Branch at Linn County Public Health. As of today at 2 p.m., there are currently 922 cases of COVID-19 in Linn County. There have been 73 deaths, and 759 individuals have recovered. 147 Linn County residents have been hospitalized for COVID-19 at some point in time, and 8 residents are currently hospitalized. Linn County Public Health continues to track and follow up with outbreaks identified at long-term care facilities within Linn County. At Cottage Grove, 6 staff and residents have tested positive. 2 of those residents have died. 4 residents and staff members have recovered. At Heritage Specialty Care, 114 staff and residents have tested positive, 26 residents have died, and 85 staff and residents have recovered. At Linn Manor, 35 staff and residents have tested positive for COVID-19. 6 of the residents have died, and 21 staff and residents have recovered. At Manor Care Health Services, 51 residents and staff have tested positive. 13 of the residents have died, and 27 of the ill have recovered. At St. Luke's Living Center West in Cedar Rapids, 74 residents and staff have tested positive. There are 10 deaths associated with this outbreak, and 59 of the ill have recovered. Several of these facilities are moving towards recovery. The recommendations for the community related to COVID-19 are not changing as quickly as they were initially in the beginning of the pandemic. This may give a false sense of security that there is nothing to worry about anymore. Some may feel that there is no risk of getting COVID-19. This is not the case. There is still spread of COVID-19 within our community. People continue to be ill, become hospitalized, and die from this disease. During this pandemic, it feels like we are on a roller coaster at times. We will be experiencing times of higher rates of illness and times of lower rates of illness. Therefore, we need to continue to practice the strategies that we have been discussing. While we have seen successes in our community, such as fewer Linn County residents who are now hospitalized, I want to remind everyone COVID-19 is still a new virus. We are still learning about the long-term impacts of the virus and what those impacts may have on children and adults. This includes conditions such as pediatric, multi-system inflammatory syndrome. This is a rare condition associated with previous infection of the virus. It is just new to our community. Linn County Public Health will continue to work with the Iowa Department of Public Health and local hospitals and healthcare providers to watch for this illness in our community. The unforeseen impacts of this virus is one more reason that we must stay vigilant with our efforts to protect ourselves and our community from COVID-19. To the extent we are able, and with the current knowledge available, Linn County Public Health continues to plan for future impacts of COVID-19. We constantly are working to build capacity for responding to this pandemic. We are strengthening our capacity to conduct contact tracing. We are identifying and addressing needs of vulnerable populations and how to plan for and implement public health strategies to protect the public health in the coming months to years. For example, if you look on our Linn County COVID-19 website, you will find information on reopening guidance, multilingual resources, and a mental health toolbox for community members and organizations. The work for Linn County Public Health and many of our partners in this response is not ending. To our community, we encourage everyone to plan for how this pandemic may continue to impact your life. Just as we encouraged you back in February to plan for disruptions of everyday life, we continue to emphasize the importance of having plans in place in the event that we begin to see higher rates of illness. All of the things that we have learned in the past few months will guide the way we respond in the future. We have not crossed the finish line to this marathon yet. To prevent the possibility of closing things down in the future, we all need to continue prevention activities such as washing your hands often, covering your coughs and sneezes, staying home when sick, no matter how mild the illness. Practice social distancing by maintaining 6 feet between people and wearing a facial cloth mask when social distancing is not possible. Thank you.
That is the end of our prepared remarks for today. I just want to acknowledge that during our live stream, we did lose sound for a little bit. We are aware of that, so we will go ahead and post the transcripts and the videos as soon as we can so everyone can hear the part or read the part that they lost during the video. So I am just wondering if there are any questions from our media partners here. I know that we do have one from Taylor Holt. Taylor, would you like to ask your question through the phone line?
Yes, we've been hearing a little bit better. This question is for Dr. Myers. There has been talk of a potential second wave of the virus coming. I'm wondering if you agree with the experts that we'll see that, and if so, are hospitals prepared for that, and what's being done to prepare that?
Taylor, I think your feed is not coming through very clear. Luckily, we knew that we might have that problem, so I'm just going to go ahead and read the question that you submitted ahead of time for Dr. Meyer. So this question is for Dr. Myers. It says, there's been talk of a second wave of COVID in the fall. Do you think there will be one? And what are hospitals doing, and are hospitals prepared for this? What is being done now? I'm going to go ahead and turn it over to Dr. Myers now.
So I talked a little bit about it, but I'll do it again. So there's 2 parts to the question. One, are we prepared? Short answer is yes, but I'll get more into that a little bit more specifically. Do I think that there's going to be a significant peak different than what we saw when it first came to the county? The short answer of that is I don't think there will be a peak worse than when it first came. It could certainly go back up to, like I was talking at the beginning of my comments, that it has gone down now. But part of that depends on what I am counting on is the same thing that I've been very thankful for of the community and the leaders and employers and everybody in this community, is that we're going to be smart. As long as we're smart and we don't fill up a stadium with people right next to each other and we're sick, then I don't think that we're going to have a significant problem with a surge. That said, the hospital's been doing lots of planning. And like I said during my comments, the We are better off on supplies. We have lots more knowledge now about how do we shift resources and space and staff within the hospital to increase our ICU capacity rapidly. We're better off with medications, and we're better off with testing. So all of those things together put us in a much stronger position now as compared to before.
Thank you, Dr. Myers. I do not have any other questions that have been sent through the chat function of GoToMeeting, but I do want to allow anyone that's on our telephone line to be able to ask a question. Is there anyone else that has a question for our speakers today? Okay, hearing none, that does conclude our press conference for today. As Mayor Nick Abou-Assali mentioned, for 11 weeks, our COVID-19 response partners have held regular press conferences to provide updates and information to protect the health and safety of our community. Given that our local situation has begun to stabilize and the rate of new information and recommendations are slowing, we are going to be transitioning out of holding regular press conferences. We will remain ready to provide information as needed. We encourage everyone to visit linncounty.org/COVID-19 and receive information through our social media channels. And our Joint Information Center will continue to meet regularly to assess the information needs of Linn County and work together to get important information out to the public. And as I normally do, I'm going to briefly summarize our Linn County metrics to date. We currently have 922 cases. 759 individuals have recovered. There have been 73 deaths, and 147 people have ever been hospitalized for COVID-19. Please continue to practice social distancing, stay home when you're sick, and wash your hands often. Thank you.